All right, so it's about 10:03. We're going to start. Dr. Alex Jahangir is our guest today. And you have probably seen him a million times because he's usually at the mayor's press conferences and he's on the news. So Dr. Alex, first of all, just so everybody understands why it's you, why is it you? Why are you the person, at the press conferences and everything else? Why is it your role to be in that lucky position at this point?
Well, it is an honor, and it is humbling, and I sometimes ask my question that maybe daily, if not hourly. But the reality is this: I was really fortunate in 2017 to be appointed to the Board of Health by then Mayor Barry. I took this position, not fully understanding the world of public health, much less in the city, and I took over for Dr. Henry Foster, who you may remember is very prominent person in healthcare. He was president of Meharry Medical College. Bill Clinton Surgeon General nominee. So I took this role and when he stepped down after 20-something years on the board, and I took it with the understanding I'm going to just learn. So sit there and learn and be quiet and be the most junior member of that board, and then. As you know, Vice Mayor, life happens, and quickly we went through a director search, which I chaired the first round, and then when we needed to have another director search, my fellow board members, it was also time to pick a new chair of the board, and my fellow board members, in I think October, voted me to be chair of the Board of Health, which again, very, very humbling. I entered a role.
So let me ask you a quick question. Were you at that meeting that they voted you, or were you just not there and that's how you got something? Yeah.
Funny story is I was physically there, but then the attorney said I had to step out when I was nominated. So I actually wasn't there to rebuff my election. But it's interesting is life happens in a wild way. Because when I took that role, I was planning to serve maybe a year. In that year, what I hope to do, and we still hope to do, right, is hire a new director, which we did, Dr. Caldwell. I have, by my day job as an orthopedic trauma surgeon, youth violence and gun violence is really important to me, and I was hoping to maybe do some stuff around that and bring some attention to that. And then make some changes to our bylaws, because the health bylaws were made really in the 60s. So I was just trying to make public health today, make our charter and bylaws reflect that. And so life happens, and the COVID crisis happened. And up until that moment, I hadn't met Mayor Cooper. And we had an opportunity to meet with the first press conference when we first announced our case. I think it was March 8th. And then, very kindly, and he reached out and asked if I'd be willing to help kind of oversee the city's response in partnership with everyone. And I said yes, because how could you not serve the city that's given me so much? And then I guess the rest is history, and still making history, I guess. But
I think you're going to keep making history. So so let me take a step back, and I will say that John Rutherford, Councilmember John Rutherford, is on the call, and he's always on the call. We very much appreciate that. My daughter Audrey is on the call, listening. So I'm glad that Audrey's listening, and your mom is on the call. So we're very glad. So don't mess this up. All right. So here's the first question, the real first question. You're from Nashville. Tell us a little bit about yourself. I know that we see you all the time, but tell us, who are you? You're from here. I know you went to high school here. Just a little bit about yourself.
Sure. So my family and I moved from Iran to Nashville in 84, so when I was 6 years old. And in this community, I came and lots of cousins, aunts, uncles, grandparents all moved to Nashville, of all places in America. And this community has given me a lot. And so, yeah, I grew up here. I worked at the Adventure Science Center, which at the time was the Cumberland Science Museum, and my volunteer gig. I actually, when we first arrived, we did vaccinations and so forth at the health department. So it's really neat for me to come full circle with that. I went to MLK Magnum High School I graduated there in 96. And it was really, it obviously shaped who I've become, because I don't know if it's still focused on health, science, and engineering, but back then that was really a focus. And gosh, I think maybe 20 out of my graduating class of 100 have entered some kind of health profession field, if not more. I went to college in DC at George Washington University, came to med school in Memphis, and where I stayed for my residency, and then went to Minneapolis for my fellowship. And then when fellowship ended in 2009, I mean, it was such an amazing opportunity to come back and join their level 1 trauma center at Vanderbilt, which is not a common opportunity to get a academic trauma job in the city in which you grew up in. So I jumped at that opportunity, and it's been an amazing experience so far. I oversee the Division of Orthopedic Trauma at Vanderbilt, and then my home job, I have three young daughters who are rising first, second, and fourth graders. So there you go.
Very, very, very good. All right. So so at Vanderbilt, obviously you do surgery. And how long have you been at Vanderbilt? Since what?
11 years. 2009.
Okay. All right. Really, really. I'm glad that you came back. That's great. So tell me. In terms of getting involved in this, I think the first time I actually ever saw you was at that first press conference. So kind of take us, if you don't mind, into, what happened right at the very beginning, and then we'll get into questions about where we are now in the phase 3 and everything else like that. But obviously, we had Dr. Wright Pinson, and he may be on this call. We've had Dr. Pinson on. And listening to Dr. Pinson, he was talking about, Vanderbilt saw this coming, you're watching what's happening in China. Here it comes, and Vanderbilt had a plan. So obviously you were a part of that mix. What happened from the city standpoint that you can tell us? Where when all this stuff started hitting and, all of a sudden we had that first initial press conference, what was going through everybody's minds in terms of trying to make sure that people were safe in Nashville?
Well, I think it's important to say, just as Vanderbilt saw this coming, so did the city. All right. I want to be very clear. Dr. Sammy Ariola, who was the interim director when after Dr. Long stepped down, him and his whole team, and the team is still there, from Dr. Gil Wright to Rachel Franklin and others, saw this coming. And so we started, as in my capacity as chair of the board, Dr. Ariola, as well as Ms. Franklin, Dr. Wright, and I, we would talk about this, probably once a week or every other week, about how's the city preparing, what are they doing in China, is there a likelihood that this may even come into the States? I mean, there was a time when nobody really knew. If you think about the bird flu and other things, I mean, we saw that in Asia, but never really came over to the States. And so for a while, there was some thought of, is this going to be something? But we monitor. It's almost like a hurricane that you see offshore. And our job in public health is to prepare for such things. And so there was preparation occurring. And then fast forward to March, I think it was 8th, when the first case happened in Nashville. It was a Saturday night. And then that Saturday night, I got a call saying, hey, the mayor would like you at this press conference on Sunday. And so I went to that press conference, and Dr. Caldwell also, who was scheduled to start Monday, was at the press conference. So he really got thrown into this, full body. And we had the press conference. We spoke about, all right, what's next? At that point, it was just one case, but we also knew that, this was going to pick up here. And so recognizing what is so fascinating about this city or great about the city is we have an amazing healthcare system through Vanderbilt, the HCA TriStar system, the Ascension system, Nashville General, Mary Medical Colleges. We, on that Wednesday, brought all those parties together, as well as representatives of the state and other leaders in the city, to talk about, all right, what are we going to do as a city now? This is in our shores, if you will, in our borders. What are we going to do? And then quickly on that Friday is when the mayor put together this task force, and every day thereafter, we've been working this problem. And the thing is, one would say, why do you need a task force? We got a Department of Health. As everyone knows, this COVID-19 affects so many aspects of life, right? So there's the health component, there's the economic component, there's the schools component. There is, there's so much more that I've learned every day. There's rec league component. I mean, my gosh, things that I never would think would be impacted by a virus. And so every step of the way, the health systems and all these amazing volunteers and people from all sectors have come in. And so that's kind of a quick glimpse of how we got to this point in our response subsequently.
Okay. So, so let's just jump into where we are now, okay? Because I think that's, you know, we know where we've been. Certainly a difficult time, obviously, in this city and in this country, trying to, you know, maneuver around something that we had never really fully, you know, something that we had never dealt with before. All right, so take us to kind of where we are now. We're in phase 2. How are we doing? I mean, so there were a lot of questions that were submitted early to us, and we may get, but so, you know, what goes in right now? So we're in phase 2. We weren't sure whether we were going to move into phase 3. We've hit that 2-week cycle, and people want to kind of know about how do you monitor that 14-day trend. So tell us kind of what's going into the thinking right now about, okay, so yeah, we're in phase 2, but he hasn't announced phase 3 yet. He's thinking about it. Kind of where are we right now? What are we looking at in hospitalizations and other things and trends? What's going into the decision making right now?
Well, I'll tell you, just the numbers I just announced a few minutes ago is today we crossed the 6,000 mark of how many cases we've had in the city. We've had 6,032 cases today, which is an increase of 132 from yesterday. But and we've had 70 people total die in Nashville from this disease. What I would say, Vice Mayor, is you know, we always in our roadmap said 14 days is a minimum before we move to the next phase. And the reason that 14-day number is important, that is the lifespan of this virus. So if you look at when somebody gets infected, by day 14, they're either going to have the virus and we'll have those results, or worst case, they'll die. And so that's why 14 days matters, because it really will give us a clean idea of how this virus is doing. 14 days from when we rolled into phase 2 is on Monday. And we felt we are doing as a city pretty well. Let me talk about the good, and I'll tell you about why we might have pumped the brakes just a little bit before announcing a phase 3 on Monday. We're doing really well when it comes to testing capacity. I would say best practices would say we test one test for every 150 residents. We're doing per week. We're doing one test in maybe every less than 100 residents. So we average anywhere from 7,000 to 8,000 tests a week, which is really across the country. I mean, we should recognize that what we as a city have done across the country, very few people are doing this. I just spoke with a person who has my role in Dallas a week ago. And in Dallas, much better community, much more resources, are doing a lot less than that. So we're doing really well in testing capacity. And that's really important because the only way to see an invisible virus is to test. Number 2 is contact tracing. Our public health infrastructure and ability to quickly recognize where this infection is. Is it something that could be contained? Is it a outbreak, for example, in a place of employment, a school? It's really important to recognize that and quickly, if you will, wall that off so it doesn't spread in the community. When we started this whole endeavor on March 8th, we had 4 people, period, for the whole city to do this. And that was adequate for the time. We'd have outbreaks of hepatitis A, which may impact 115 people. We now have over 125 contact tracers in Nashville. The state, I don't know, per capita definitely doesn't have that. And I would say most places in the country don't have that. In addition, we're looking at other ways to build that infrastructure, whether it's electronically and other things. So I feel really good about that, because if we didn't have those 2 things, the numbers are not, it's hard to make sense of the numbers, and it's hard to say, it's open. Our hospitals have been really great. As I mentioned, we have an amazing system here in town of hospitals. Our hospital capacity, I believe today, is around 20, if I can look right here in my report, is 25%. Yeah, 25% of hospital beds in Middle Tennessee are currently open, as are 25% of ICU beds. And that's, one should say, if you look at how many people have had COVID over the past month, it's been, the number of people hospitalized with COVID in our region has been hovering around 100 or maybe less than that. So we have the capacity.
You're saying 100 people at a time.
Yes, sir, per at a time, at a day.
So let me ask you a question, because this may come up. You said 25% of the beds are open. Is that right?
That's correct.
Okay. Is that okay? I mean, if somebody said, well, that doesn't sound like a lot, but that's okay. We're okay with that.
Oh yeah, I would say 25% of beds open is, even before COVID, is a very comfortable place for us to be. And that is of beds that we normally have, okay? That doesn't include surge capacity that every hospital has come up with. And it doesn't include the alternative care side at Nashville General, which was opened up or available to open up as yesterday. And so, yeah, I feel really comfortable about that. So that leads us to the metric of case trend. Okay. So as I mentioned, we have 132 today. The past few days have been great. We had 61, I believe 80, and another relatively lower number. The 3 or 4 days before that were all in the hundreds to 130s. And so given Memorial Day weekend, given this increasing trend, we just wanted to just pump the brakes and just to slow down and just make sure that the numbers these next few days stay in a reasonable, manageable number. And if it does, I'm not making promises, don't quote me this, but if it does, we very well might on Monday say, listen, we looked at more data. Data shows that we're doing well. Hospital capacity is good. Case trends haven't spiked in the 200-300 range. Let's roll into phase 3. And phase 3 will be probably different than what we would initially announce, because the great thing is through this process, we've heard feedback from really smart people who know their industry best and how best to make it better. And listen, as a city, we want to open up, right? We want to give people opportunity to get back to doing things. Great example of that, I think, is if you look at what we did with live music. We allowed it, and then we now expanded how many people can be on the stage. Look at hair salons and gyms. We moved those into phase 2 because those industries really had great best practices. And because we have the contact tracers in place, if something were to tick up in one of those industries, we would know it relatively quickly and tamp things down. And so anyway, that's a lot of talking, but it is really important. There's so many different variables that go into this. I really appreciate the opportunity to have a little bit of time to have just explained that. Thank you.
No, I think that's great. And I think that's what people want to know. I think it's important that we understand that people watching all this, a lot of thought has gone into this to make sure that the information, the data that you need is given to you so you can make good, sound decisions. All right. So getting a lot of questions from people that, I'll put these two questions together. Okay. So we've had a lot of rallies, obviously, over the last week. Are there concerns that we could see a pretty good spike, because obviously there were a lot of people in small spaces together? And then the follow-up would be, if you do see an increase, what are you watching for in case, instead of moving to phase 3, what are you watching for in case we need to move back? And do we have that capability?
Sure. I guess the first part is sure. Anytime there are a lot of people out in a close proximity, things we got around the rallies and protests is the positives. From what I understand, a lot of people were wearing masks. It was outdoors. People had transient contact with each other. From again what I've been told and have heard and have seen. Those are all good things to hopefully minimize the risk of spread. But again, people were together and people were yelling, and yelling projects things out further. And so sure, that's something that we have to continue looking at. And it typically takes about 5 to 7 days to start seeing an impact. I again highlight Memorial Day. The numbers showed up earlier in the week, the 130 multiple days. But we'll continue to monitor it. As far as what are we looking at to roll back, perhaps, it's all those metrics we talked about earlier. Let's say all of a sudden hospital capacity goes down a lot. Let's say our number of people hospitalized because of COVID goes up tremendously, whether that's a nursing home was infected, or people just for some reason the virus became more deadly or make people more sick. Let's say we start seeing a huge spike that is not something that we can explain. So, it's one thing to say, all right, there was a nursing home that was pretty isolated, and there was 300 people in there, and we were able to contain it and deal with the repercussions. That's contained. That's not going to be 300 people who've now gone into the community and spread it to others. But let's say there was some event that a lot of people got the infection and they spread out. Well, if we needed to, we would. Obviously, we don't want to hold back. I'll tell you this: what people of Nashville have done with Safer at Home and being such a willing partner to work with us, we have saved lives. We have saved the opportunity to allow us to open up as quickly as we have. I mean, the projections, I mean, we were building a 1,600 bed hospital in the Music City Center, right? I mean, that decision wasn't made lightly. I mean, that was millions of dollars made by the federal government and the state. So it wasn't just me and Mayor Cooper and a few other people sitting around saying, oh man, we really need this. These were a lot of really smart people who were looking at the epidemiology and the trends. And because we as a city, one of the first, if not the first in the Southeast to implement Safer at Home, but more importantly, have people in the city that respected that and followed along, we were able to flatten that. And so I'm so proud to be an Nashvilleian because of that. I mean, so I don't know. We'll keep watching it. Trends are looking good, though. I want to highlight that. So there you go.
All right, good. So yeah, I've been very, very proud of Nashvilleians. I think they've done an excellent job of paying attention and taking this seriously and being very careful. So I was at the rally last Saturday, and yeah, it may have been a lot of people, but people were wearing masks, and that was, I thought that was really, really good. I think people understand that, you know, other things going on, but we're still in the middle of this pandemic, and we're going to have to get through it. It's not going anywhere. Okay, so I'm going to ask you a question that you may not want to answer, and that's fine. But somebody asked a question and said, who is on this task force that is, you know, working together each week? And I guess the follow-up question would be, you know, is it one of those things where you all meet at a certain time and then come up with the information? You know, it's like you look at it, you look at the numbers, and you go, okay, this is our recommendation, and then you make that to the mayor. How, you know, how does that work? And who's on there? Who's helping and
Sure.
helping to make these decisions?
So it is very fluid, right? So I think what I think sometimes the word task force becomes so constrained, right? I think it really there are a lot of people who are very involved. So public health officials who are not just in the department, but at Vanderbilt and Meharry Medical College, external to all of this, help with certain decisions. The healthcare executives that we spoke about, whether it's you know, Vanderbilt and TriStar and Ascension and Meharry Medical College, National General. When we talk about health systems, the Tennessee Hospital Association, those individuals are in those decisions. When we're making decisions around schools, school people are involved in those decisions. So when it comes to your question about when we make a decision of what do we, what's in phase 1 versus phase 3, there is a technical advisory group that's in the Department of Health. Those individuals, and as well as myself and some external public health officials will look at those recommendations. When it comes to do we roll into phase 2 or 3, same thing. Like for example, whether we just pump the brakes here, I looked at the data, as did some of our public health colleagues. I spoke in this case with Dr. Hildreth, some other individuals in out of Meharry and Vanderbilt, and we said, hey, this is what I'm seeing. So do you have some pause, or are you okay with us going? And everyone's like, all right, let's just see what happens over the next 5 days. And so it's not like we meet at 9 o'clock every Monday. I mean, I'm on the phone all of the time with so many great people in Nashville, all of whom are willing to share their time and expertise. And so it is really broad, but I guess the core group would be the healthcare system executives, people in public health, and a few external public health officials.
Well, let me say this to the people watching. So you're on a call along with Dr. Caldwell and usually Dr. Hildreth with the Metro Council members on Thursday. You're on there all the time. We know that, I mean, you've got a million things going on, but you take the time to talk to the council. That's very much appreciated. And you know, whenever I've called you, you've called me back, and it's like, I don't know how he has time to do any of this stuff. But the level of communication from yourself and from the folks tied in with, you know, everybody else that's working on this has been really has been great, and we certainly appreciate it. It means that you're trying to get the information out. That's great. So let me ask you about going forward. Okay, so we talked about phase 2, phase 3, but I'm talking about, I guess I would be talking about the summer. You know, initially we had heard, you know, that maybe with the heat, it would kind of become dormant and then it might come back in the fall. Talk about what you see as the summer and the fall. And then behind that, and I'll remind you if you forget, is what can you tell us about the vaccination stuff? What do you hear about that? where do you think all this stuff is going over the next several months?
Gosh, it's such a great question. And I think as you know, and most people watching probably here know, is there's so much yet to be learned about this virus. Um, there is some evidence that there is some seasonality to this, similar to influenza. And so if you look at where those peaks are happening now, they're really in the southern hemisphere. So there very well could be some seasonality, which is great for us right now. And what it has, hopefully it will continue to give us more time to continue building our infrastructures and all the things we need to do. Regarding the vaccine, I think there's some great work being done. I've read some stuff a few days ago, but there's so much news out there and information. It's hard for me to say, yes, there's going to be a vaccine in 6 months. I've heard some really smart people say that, to, gosh, there won't be a vaccine for years. And so we have to prepare for, and I actually hate this word, but I'm going to say the new normal for moving forward, right? So when we look at fall, I mean, summer, I mean, there's activity. So I was supposed to actually right now be on a really huge Disney cruise with my family. Okay. But obviously that's not the right thing to do at this moment. So we made amendments and went to the beach for a few days, where we drove and we're in a secluded place that we didn't have to interact with people. So there'll be something like that when it comes to summer vacations and summer camps, that there'll be something different. When it comes to the school year, I think that's another thing that probably a lot of people are thinking through.
So that was I always wait for the big question about 20 minutes till, but go ahead. That's the question that we keep getting is, talk about schools. So go ahead and go there.
And I think that's relevant for fall, right? Because when I think fall, that's what I think about. Right. I have a rising first grader, third grader, and I can remember first grader, second grader, and fourth grader. Trust me, the number one lobbyist I have for schools being open is my wife, and secondarily myself. I mean, I hear it. And then I think that's something that's really, it's really important. I mean, it's important for kids to be in school if it's safe for both, because of both development, for personal interaction, personal growth. It's important. I mean, it's important for many other reasons as well. So I'll tell you, there will probably this week will be a more formal announcement. There's been a really amazing group of individuals led by Dr. Battle and me, as well as a lot of experts from the different kinds of schools here in town that have really been given a lot of thought about schools. And I hope that we'll be able to present a national plan, if you will, that will serve kind of as a floor for people, for the different schools, whether you go to an independent school, a religious school, a charter school, or public school, which will allow things to maybe schools to open. I will say, again, all that depends on how this virus is doing in our community. I mean, if we're in a stable place like we are now, then I think and hope that there will be an opportunity to have schools in the fall. Now, if we go back to where we could have been when things were really rampant and hospitalizations are high or something like that, then we have to be prepared for the opportunity, possibility that there may not be schools. But right now we're doing well as a city, and we have to really be thoughtful about how we open up every sector. So whether it's the restaurants or the places that play music or schools, and we've really given a lot of thought and are doing our best with the science and the data and experts available.
So obviously we've got people on the call. They're very interested in this. Sounds like something's going to be announced this week. At least we hope, from either maybe a press conference or something with Dr. Battle about it. But you're not going to tell us any more about that. You're not going to give us any inside information about what we should expect.
I mean, I'm not trying to be coy. I mean, I think I try to give the broad strokes. We have it's a very extensive report that I believe will be released this week by Dr. Battle, that really gives people a guidance on how schools could reopen if we so chose. And I again, as in this formal role, as well as a parent, I feel comfortable with the guidelines. But again, it all depends. I want to highlight this whole this whole virus thing is still so much to be unknown, right? Will this flare up like the flu of 1918, the pandemic of 1918, and have a bigger second wave than we had in the first wave? I don't know. I hope not, but we all have to be aware that there's always a possibility of things changing. But please stay tuned for more exact details. But know that there's been a lot of thought given to that, and I'm really proud of what this group is going to announce later this week.
All right, so 2 questions, and it follows along. You may not be able to really answer. Well, the first one you might be able to, regarding the schools. So, at some point we watched what was happening in other countries like Sweden, for example, Denmark, other places like that. Sweden, I know different health factors, different conditions, different country, but they sort of kept going, and their schools stayed open. But one of the things that I don't know that you may know is, were we looking at other countries as well in terms of how they did it? And maybe the ultimate question is, I'll give you a scenario. So let's just pick, McGavock High School. You got 1,000 kids in there, 2,000 kids. How do you deal with a situation like that? Because, obviously it's still here. Pandemic is still here. You got 2,000 kids. It's going to be hard to keep them all socially distant. But if you bring kids back into school, and then there's an outbreak, what do you do? Yeah, if you, and you may not be able to answer this, but then you shut down for what, 14? You can't shut down for 14 days because then you bring people back, and then there's another outbreak. So then it's like, why did you even do it? So is that being part of the process of trying to understand maybe what happened in Sweden and how they dealt with outbreaks in the schools? And then how do you deal with it here in a situation like, if you're going to open, you may have outbreaks, and how do you deal with it?
Yeah, I think you're right, and there's a lot of discussion this group has had, and the guidelines will provide a lot of direction around that. Now, I will tell you this: like, there will always be some people that just aren't as comfortable with those risks. I mean, everything, me choosing to go to a grocery store, there's a risk. I'm not saying that there's not a fail-proof answer, right? There's going to be, but there are best practices nationally, internationally. We actually, in the process of determining these guidelines, spoke with people in Hong Kong. We spoke with people in another country. I apologize, slipping my mind right now. We spoke with people around the country of how they're rethinking this. Pediatricians, infectious disease pediatricians, developmental pediatricians. But there's going to be some guidance around that. I will tell you one thing about Sweden, and I don't mean to change the subject, but I will say, I think everyone always talks about Sweden and their herd immunity and everything's great. What people won't talk about is the mortality rate in Sweden per capita is actually relatively high. So it's almost like the U.S. It's in the 5 or 6% range. And so I think people always want to hear the best in a situation, but there are kids for the most part regarding this virus haven't been badly impacted, although there is this new pediatric inflammatory syndrome. So there's a lot of variables, and so I wish I could give you the magic answer that makes everyone calm and feel like it's good. But know that all those scenarios have really been thought through, and it's a pretty extensive report. We'll hopefully answer that question a little bit more in detail for you.
No, and that's fine. No, I appreciate that. So talking about Sweden and Denmark, how do you all, from this group that's watching, obviously start with China, start spreading. Now it's down in the big outbreak is now in Central America.
Sorry, Brazil.
Okay, so there is so much information going on and so many different parts of this whole thing that you're looking at. I mean, remember, it wasn't that long ago when Italy was, the core, and everybody had locked down. I'm not even sure if they've let people out on the streets. I assume they have in Italy, because there's so much information that you're trying to keep up with it all. Question for you is, how do you keep up with all that information? How are you taking what's happening in China, and then you've got I don't even know. It sounds like they got it under control, and then I heard something that maybe it had come back, and then you've got other places, and then you've got Brazil. How are you getting the right type of information to be able to kind of study the trends and figure out what's the best thing for us to do?
Well, I think, as I mentioned earlier, it is definitely a village of really smart people who, for example, I'll see, let's say if I come across a story, I mean, I never will take it at face value. I'll send it to a colleague of mine, maybe locally or elsewhere, say, hey, what do you think of this? There are some great work that's being done out of, very selfishly out of Vanderbilt, both in the Department of Health Policy as well as infectious disease people. In fact, ICU doctors around the city I speak to regularly. Meharry Medical College is doing some great work. I speak to some of those colleagues. When I see a story, I'll send it to them. Like, hey, what do you think of this? Memphis, one of my first people I spoke with was the person who's kind of advising Mayor Strickland around this, and I'll speak to that individual as an infectious disease doctor. I for a while would speak to him daily. It's kind of now become almost weekly, just to see what he thinks of things and what they're seeing. So I by no means have all the answers, and I've always I'll be the first to admit that. But there are some really great people who have a lot more expertise, and people reach out, and even people who I don't know will sometimes reach out and say, hey, what do you think of this? And sometimes, and a lot of times, it triggers something, and I'll go and shop it around to see what others think of an idea, because by no means have I or a lot of the people I work with think that we know all the answers, because it's so new. And so we just, just I guess how everyone processes a lot of things. But you're right, there's a lot of information out there, and I'm an open book. Anyone has any thoughts, please throw them my way.
You may get a lot of calls for having said that. But I understand that, and I think obviously we're all learning and trying to figure all this stuff out. All right, so it's about 20 till. A couple more questions, and then I'm going to go back to the fall, because, like I said, about 20 minutes till is usually my last big question, and you answered it. Cool, so that's okay. No, I've got another one now. But someone had asked a question about construction projects. Obviously, they kept going, essential workers. And the question was about, what are they required to wear? How are we trying to keep them safe? I know they've been on the job. Construction has continued in Nashville. What are the requirements for folks trying to keep them safe?
Sure. So I'm going to try to do this from memory, but I think a lot of the things around construction apply for all industries, right? So in construction specifically, we do recommend that everyone wears a face mask, and most employees should wear a face mask, a cloth face mask. It's been shown that if you wear a cloth face mask, if everyone in the community, if 80% of people in the community wear cloth face masks, the infection rates have been shown in different studies to drop to about 1/12 to where they would be. I highlight the community of Japan, right? The country of Japan, excuse me. The Japanese are used to wearing face masks. I mean, because they've had these previous epidemics. Japan has not gone on lockdown in this current epidemic, and they're not having these terrible trends. I think part of it is because they have practiced these kind of, some people think, mundane things. It's wearing a face mask, washing your hands, 6 feet. Around construction, those apply. Also, when you're in an elevator, I think we try to tell people, listen, don't get on an elevator too close to someone, spread apart. Regular hand sanitizing. When you're taking your lunch break, really sit apart. Don't share food. I mean, there's common sense things, but people just need to follow them. And it's really easy for me to say that, doing what I do for a living, right? But it is really important that you also, if you're an employer of construction workers or any essential workers, you got to make some adjustments to what you do, and really make it safe for your employees. Because if you don't, you have badness. And I think you had a recent example, as you saw in the city, about 80 people at a construction site were infected, and that's not great. I mean, by any means, not great.
Okay, so another question that came in, testing. Okay, so give us a little bit more information on where we are with testing and the turnaround time. So, somewhere out there in the past couple of weeks, it was, you could go get tested. Initially, we were just testing people. They were supposed to call the health department. And then if they were showing signs, they could go to a different place. really what we understood was that anybody could get tested.
Mhm.
Where are we now with testing? Where are the sites? What should you do? And what's the turnaround time on the testing at this point?
So as a city, it's the number I just got last night. We have done 64,335 tests total in Nashville. So 64,000 Nashvillians essentially have gotten tested. Some have gotten tested twice, that number, which is really, really good. I mean, it's really good. Of the people who have tested, 9.4% are positive. And we've been at that 9% number for a long time. And that shows when you have a number a little around 10 that stays stable, that shows that we really are getting a sense of the prevalence in the community. So we're done really well. I think about 20,000 out of this number in front of you, but I think over about 20,000 of those tests have been done in our 3 community assessment centers. Community assessment centers are on Nissan Stadium. They're at Meharry Medical College, and they're at the old Kmart in Antioch off Murfreesboro Road. Right. Those centers are open 5 days a week from 9 a.m. to 3 p.m. and they're free. Just show up. And yeah, we're testing everyone as of, I think, April 17th. We started testing anyone that shows up pretty much. Now, you will get an assessment. Understand that you could be having shortness of breath because you're having a heart attack, right? So I think some people for a while got a little, they didn't understand why I said you still will get assessed. Get assessed because you could be having you could have a heart attack. You could have an asthma attack. There's reasons you could be short of breath. Now, the symptoms to look for is shortness of breath, a dry cough, fever, loss of smell and taste, and as well as, believe it or not, diarrhea that's unexplained may be one of the 5 symptoms I would look for. So if you have any of those, or if you've been exposed to somebody, or you're just worried, just go get tested. Now, coming to your question of turnaround, great thing is I also get an update on what the turnaround time is in our different labs. And in the city, we're averaging around 2 to 3 days right now. Some places are a little faster. Fewer places are a little slower of the many labs that report to us, right? So there are, guys, probably about 10 labs that report to that Nashville residents get tested at. It's about 2 days, which is a lot better than where it used to be. It used to be 5 to 7 days, or we run a lot of private labs that have really opened up their capacity of testing now. So I hope that answered most of those questions.
Did. Okay, so this is a question just for me. I made this one up. Most of them are made up by me anyway. But no, I'm actually, the chat box comes in and we try to keep up with the questions and then I try to follow up with them. But here's my question. So I have not been tested, but people talk about that swab going up into your nasal capacity and going like they're digging into your brain. Explain what is happening and how far does it go up into your brain? It doesn't really go into your brain, but I mean, but people are going like, yeah, you got this long thing. It looks like a Q-tip and, what is really happening? And my question would be, does it hurt? Okay.
Yeah. So, I actually witnessed a loved one get the test and it really looked painful. I've never had it done myself. I've never had but here's the thing. It's been shown that the best place to get the sample is really, it is essentially to the back of where you put in the nose, almost to the back where it meets the back of your head, and it's not comfortable. There are some people, some tests now that are showing that saliva and maybe I'll do a spit sample, which would actually open up testing even more because you can do it at home, right? Or you can have kids get tested. And so, yeah, it's not pleasant, but it is that test, which tests for the RNA of the virus, is the gold standard right now. So I want people to don't until the science has shown that you can do a spit test. If you're worried about the virus, get the test that will tell you. And even that test has a 70 to 80%, has a 20 to 30% false negative test, right? So you still may do that and then be negative on the test, but you may have the virus. So nothing's 100%, unfortunately, but that is the thing. Now, people talk about antibodies as well. Maybe we can talk about that for a second. Sure. Antibody testing it is important to see if you've had the virus and if you have immunity to it. There are a lot of antibody tests right now. The problem is the FDA hasn't really approved a lot of them, and they're not really that meaningful. There's some big studies going on right now that are looking to see what impact there is and how many people in our community may have had the virus that didn't realize it. I will tell you this: I had an antibody test as part of a study. I was negative. So I've never been exposed to it as far as this antibody test is it. So I think a lot of us hope that we were, and I've been around a lot of people in healthcare and other things. And so we're not to a point of herd immunity. So you need about 70% of people having antibodies to be able to be comfortable that you probably won't get around community. So we're nowhere close to that. That's why, again, these measures we've talked about from social distancing and hand hygiene really are still important until we have that vaccine.
Okay. Well, let me go back and clarify something. When you were talking about the test, you were talking about all the way back in the head. It's like, that thing is not that long. They're not sticking it all the way back to the back of your head. It's just, it goes up.
They're sticking it as far back as it's going to go. There's no sugarcoating this, Vice Mayor. This thing goes back.
Okay. Thank you very much for that. I appreciate that.
I don't want to discourage anyone from getting tested. Get tested, please.
That's helpful for me to know. And do you get a lollipop after you get tested? Or do they give you one of those little, okay.
Not at our community assessment centers, but you may get a mask, but you know.
All right. So here's the big question. This is now, since you took the schools thing away, do you think we could have college football this fall?
Oh man.
Okay, and you're
entitled to get right? They're taking a cup, or taking a glass of water.
You're almost out of time, so you may be able to stall for a little while. What do you think? We won't hold you to it. What do you think?
You know, it's really I mean, it's not just college football, right? So college football, concerts. I mean, once we roll into phase 3 for our city, it's that next step of big things. I hope so. I mean, I like college football. I like NFL. I'm a huge Titans fan. I don't know. The question is, can we have it and still have 70,000 or 100,000 people together? I don't know. I don't right now. I don't feel I wouldn't go for what it's worth to 100,000 person arena right now. But could there be a way to have college football and maybe not have it as packed and all the fun stuff, the tailgating and all the, the people cheering? I don't know. I wish I had a better answer for you, but I just don't know.
Okay. That's fair. Okay. Switch over that to something a little bit easier, but downtown and the tourists coming back. Obviously the tourists have already started coming back.
Yep.
Had a discussion with a lot of the downtown folks a week ago. I called them in and said, do we have an overall plan? And they're working on something, but I don't know. It's not an overall plan yet. Are you all involved in that? I mean, because obviously, we have a proposed property tax coming up. We got a budget that we've got to pass in the next month. And a lot of that is due to the economic condition of the city, that all of a sudden people didn't come, all that tourism revenue was lost, sales tax revenue was lost. Obviously lots of people would like to get back to business, and we are to some extent, but I think I've said this on this program before. I never thought I would miss bachelorette parties and those the people riding around on trailers screaming at us, and now I do, because we'd like for them to come back. They were an important resource. So anything you can tell us about what's happening with looking at kind of how we start bringing tourists back, but we keep, and this is what's tricky, because we can do everything we want, and we can really force our business establishments to take the necessary health protocols and do all that, which is great, and put a green note in the window, which is great. I love that. But it's the people coming in from other places that may not wear masks and that may be sick and not know it, that may, they may spread the COVID-19 to other people, and they may also get our own employees sick. So anything that you're working on there, or that's a really big question, and I'm not sure what the answers are right now.
Yeah, can we go back to the college football question? Maybe.
No, that was the easy one. A little bit more difficult.
No, in all sincerity, I hear what you're saying, and there are a lot of different plans and thoughts about how do you keep people safe. So it's not just keeping the visitor safe, but how do you keep the bartenders and the waitresses and the bell people at the hotel and the valet. There is a lot a lot of work, some that we are doing in conjunction with our business partners and Department of Health is doing, and there's some that some private entities are doing and advising. So there's really not a one size fits all answer. I wish I can't give you that. But there are some things that we're thinking through about how do we make Nashville, how do we make tourists feel that when they come to Nashville, it's going to be safe. And yes, there are some things we're thinking through with that. I don't have a firm answer, but things like Good to Go is a really nice project, or project's the wrong word, but nice thing that Convention Center is with conjunction with Vanderbilt are doing, which I think gives people that seal of hey, this Lisa's business cares and is doing certain things that are right. Maybe there becomes protocols around testing and other things. It's still really early for me to give you a firm answer, so I'm sorry.
And that's fine. No, I think when we brought these folks in and talked, I think there were a couple things we were looking for. One was, obviously they're trying to figure this out. Other cities are doing the exact same thing. So are they talking to other cities? Even though I know that there's some, Las Vegas is kind of opened up, and, there's always that competition about getting that tourism dollar to those places. So you don't want to rush. You want to do it right because it's important for the city as a whole, not only, just for the city, but, you are talking about people that are here as guests of ours. And then you're talking about the employees as well. And you're trying to figure out, how do you do this right without overstepping? And obviously the convention business is very, very important to the city, and we've got to deal with that. All right. So let's see. It is about 10:55. I've got, this is my last big question for you. All right. So, it's lots of stuff going on in the world, obviously. People, stayed in their house, safer in place, did a great job with all that stuff. We're now opening up we're now in phase 2, maybe getting into phase 3. I drove, you kind of forget, I hadn't been outside like an 8-mile parameter of Nashville for like 3 months. I forgot what it was like. And I had to go to Williamson County the other day, and there were cars everywhere. I mean, it was like I was so unused to it that when I got there, it was like, this looks like a normal Saturday afternoon, in Franklin. There was traffic everywhere. I know we're always, Davidson County, with the governor's orders, we had the ability to kind of make our own decisions. And I applaud Mayor Cooper. I applaud you, Dr. Caldwell, Dr. Hildreth, everybody involved in this. I think you have been doing such an exceptional job, and I really do appreciate that. So here we are in phase 2, getting ready to go into phase 3. Got tourists coming back. We've got these decisions being made. Here's the question. How do we make sure we don't let our guard down? How do you make sure that, we always knew this was a possibility, that when you go like, okay, we're in phase 1 and we're in phase 2, people go, okay, it's over. We're out and about. We're entering the summer. It's beautiful outside. It's going to be hopefully a beautiful weekend. It's warmer now. How do you keep driving that message that this is still here?
Yeah, thank you for that question. That's, I think again, the great people of Nashville, like, they get it. And I think it's so easy to get complacent, right? I can find myself perhaps doing that, right? I don't, but I could see very easily, because this is tiresome. And I think we just have to, just remember where we were and where we've come to. And I just ask all Nashvillians, and honestly, our surrounding counties, I go down to Williamson County occasionally, and I've seen exactly what you're talking about, this isn't over. And if you look at Montgomery, Alabama, which is 3-4 hours, they don't have ICU beds. Like, people really close to us are struggling here. And so I think I just have to ask Nashvillians to do what Nashvillians always do, which is just rise above what people in the rest of the country may fall into, and just remember, this isn't over. Wear your masks, social distance. Doesn't mean that you have to be in your bubble in isolation, right? Like, I think humans are naturally social animals, beings, right? And so find ways to interact with friends and family, but maybe less hugging, sit further apart, maybe do it outside. Make it so it's not as unbearable for you. But remember, this is not a joke. I applaud businesses that have taken this seriously and have like one-way paths and that regulate how many people come in and out. I applaud individuals who have done so much for making masks and making the families do what's right. And I applaud our first responders and our healthcare systems and our healthcare employees for doing what they do. As I mentioned at the beginning of this, I'm now almost back to practicing full time, and there's worry, right? And people are worried, but people do their job, and so do it for us, just do it for everyone else, everyone around you, and do what Nashville does best. And I've seen it growing up as an immigrant who came to the city and had people in Nashville give me all the opportunities I've given. I saw it with the floods when it happened when I first moved back again. I've seen it with tornadoes. I've seen it with so many other things. This is just a much longer duration than any of those. And just Nashville, don't give up and stay strong.
Dr. Alex Jahangir, thank you for being a guest on this Zoom call. For me personally, you've done such an outstanding job. Keep up the great work. I so much appreciate it. Obviously you didn't know that when you stepped outside of that board meeting, what you were stepping into. But sometimes I think people are put into positions somehow that we need at the moment. And we've been very fortunate and lucky that you were there. And so thank you. Very much appreciate it.
Thank you so much.
So again, I appreciate you taking the time. I know you got a lot of stuff to do. We will be on next week with Justin Wilson, who is the comptroller, and Jason Mumpower, who is the deputy comptroller. I would recommend that you tune in if you can. The comptroller I've known for many, many years, and he is very funny, and you never know exactly what he's going to say. So it should be a very interesting conversation, and I'm looking forward to it. Dr. Alex, again, thank you. Dr. Alex's mom, if you're still on, thank you, because I will say that your son is doing amazing work. Thank you all, everybody. Again, stay safe and have a wonderful weekend. Thanks, everybody.